and welcome to Hopkins. My name is Redonda Miller, and I really have, as president of the hospital, the distinct pleasure of welcoming you all to our institution. As president, I have also had the immense pleasure and privilege of working closely with Congressman Elijah Cummings on a variety of issues, and we are grateful for his steadfast leadership nationally and on behalf of his local constituents here. We are truly lucky to count ourselves among those he has expertly represented for more than 2 decades. And Chairman Gowdy, we are honored to be a part of the House Oversight and Government Reform Committee's efforts to find meaningful solutions to the opioid epidemic. Thank you all for being here today. It is no secret that we are in the throes of a crisis that has reached epic proportions throughout our country, and Baltimore is no exception. In 2016, we averaged nearly 2 fatal opioid overdoses in the city per day. This is a problem in desperate need of thoughtful answers. As both an anchor institution and a steward of health care for our local communities, Hopkins takes this problem very seriously. We see firsthand the devastation that wielded by substance use disorders. Here and at our sister hospital to the east, Bayview Medical Center, the number of opioid overdose patients seen in our emergency departments doubled last year, doubled. This crisis is very much a part of our reality. So what are we doing about it? Well, as an academic medical center, we are addressing the issue through the lens of our tripartite mission of research, clinical care, and education. First, research. Hopkins research runs the gamut from bench to bedside, starting with the original identification of the opioid receptor in the brain by Dr. Solomon Snyder in the 1970s, to the multitude of clinical trials that currently are conducted in our behavioral pharmacology research unit on our Bayview campus. We are working hard to make an impact on the science of the field. Clinical care. We're working on 2 fronts: treating the disorder that already exists and preventing future addiction. In addition to our inpatient treatment units, our Broadway Center for Addiction logs about 25,000 outpatient visits each year. And the program is comprehensive, addressing not only medical issues, but mental health, social service, and family needs. And at Bayview, we have specialized programs targeting pregnant women, youth, and adolescents. Perhaps just as importantly as treating, we are working aggressively to preventing pathways to substance use from ever opening. We've implemented guidelines that emphasize wise prescribing of opioids, such as limiting the doses on first prescriptions, particularly after surgery, and eliminating automatic refills. While patients are with us in the hospital, we have pain specialists work with them to find alternate modalities of treatment for their pain. And we provide access to naloxone for patients with substance use disorder who visit our EDs. But we haven't stopped there. The third part of our tripartite mission, education. As educators, we are working to ensure the next generation of physicians and providers are taught these best practices in treatment and prevention by incorporating them into all aspects of their training. We realize that the work we're doing is just one piece of a vast, complicated puzzle. The opioid epidemic is, after all, a public health crisis that requires a system-wide approach. Among our partners is the Johns Hopkins Bloomberg School of Public Health. The school's Bloomberg American Health Initiative, launched last fall with a generous gift from the Bloomberg Philanthropies, is funding innovative research projects, partnering with community-based organizations, and working with policymakers around the country to implement evidence-based comprehensive solutions. And beyond our Hopkins campuses, we rely on the expertise of so many other health-related institutions and businesses, from the Baltimore City Health Department to our local pharmacies, our payers, and you, our elected leaders. So I look forward greatly to today's testimony from a dedicated and informed group of witnesses. I am confident that your work here will move us forward to achieving solutions to the crisis. So thank you. And now I'm honored to yield the floor to the esteemed Mayor of Baltimore City and friend of Johns Hopkins, Mayor Catherine Pugh.
First, let me say good afternoon to everybody. And to this esteemed committee, thank you for being here. And Mr. Congressman, to both of our congresspersons, I see Congressman Cummins and Congressman Dutch Ruppersberger is also here with us. And Mr. Chairman Troy Gotti, thank you so much for convening this meeting here in Baltimore at one of our most esteemed institutions in the world. And so we are really grateful because everybody knows at this point that we are in a crisis. Opioid addiction, we are suffering from it here in Baltimore, but the nation is suffering. And it is important that we pay close attention to what we do as it relates to the individuals who are suffering from this and the communities that are being destroyed by it. And so we know that in Baltimore City we have a big problem, but we know that we are part of a larger problem. I was thankful to our governor who has convened a group to look at this particular issue, and we are focused on not only making sure that people don't get involved with drugs, but doing what we can to keep people from overdosing. I have one of the greatest, I believe, health commissioners in the country, in Dr. Nguyen, who is really focused on this particular issue. So I want to again welcome you all here, and I know that this panel will continue to deliberate over this particular issue, and I look forward to hearing the results of this panel. So we welcome you to Baltimore, but more importantly, we understand the importance of your work, and we look forward to results. Thank you. And now I have the distinguished honor of bringing before you the governor of the great state of Maryland, our governor. Mr. Governor, come on up. Governor Hogan, thank you so much.
Well, thank you, Mayor Pugh, and thank you, Governor Christie. As you know, Governor Christie chaired the President's Commission on opioid, and I want to thank Chairman Gowdy, Congressman Cummings, Congressman Ruppersberger, and all of our members of the House for coming here today to Baltimore. We thank you for holding this important hearing here in the city of Baltimore and in the state of Maryland. And I also want to thank all of you in the audience for being here today, and those of you who are going to testify before the committee and that have enough interest to be here. This is a national crisis, and it's something that I've been very passionate about for about 4 years. When I first decided to run for governor, I was traveling the state of Maryland. And every single town and community that I would go into, I would ask the local leaders, what's the #1 issue facing your community? And it didn't matter whether I was in Baltimore City or urban areas or wealthy suburbs of Montgomery County and the Washington suburbs. It didn't matter if I was in a small rural town. The answer was always the same in every single place I went. They said the #1 problem we're faced with is heroin and opioids. And it came as a shock to me, but during our campaign, we started bringing in folks involved in treatment, in education, interdiction, crime fighting, state's attorneys and police officers, and we got all the input we could. As soon as I was sworn in as governor, one of the very first things I did in January of 2015 was put together a heroin and opioid emergency task force chaired by Lieutenant Governor Boyd Rutherford. They traveled the state and held hearings in every part of our state where hundreds of people would show up to testify and tell their stories of addiction and the problems. And we came out of that with 38 recommendations, all of which we implemented, focused on every aspect of the problem, and it continued to get worse no matter what we tried. We became the first state in America to declare a real state of emergency, just like we would for a natural disaster. And it is a national disaster. And just so far this year in our state, 1,180 people have died of overdoses in Maryland. And almost every single day, people are dying in parts of our state from one end of the state to the other. For the first time ever, this has now evolved from, we've reduced the number of deaths from prescription opioids. We, for the first time ever, have flatlined heroin overdoses. But we have a 70% spike in fentanyl and carfentanil. We have 850 of our 1,180 deaths are from these new synthetics. So as we all try to wrestle with this issue, it constantly evolves, and so must our effort to fight it. And I just want to thank the Governor Christie for his work, the committee for their work, and the interest and focus on this, because it is not just a health crisis, but it's impacting and tearing apart families and communities from one end of the country to the other. And it's going to take an all-hands-on-deck approach. The federal government working with the state and local governments, along with people in the private sector and hospitals. I want to thank Hopkins for hosting us today too, but I want to thank all of you for your interest and say that I called on the federal government back when we did our state of emergency and said the federal government ought to do the same thing. And that would be my recommendation to the committee. We've got to have federal funding, and I would say this is the most important problem facing our country. So thank you all for focusing on it. I'm going to turn over the floor to Chairman Gowdy, who's going to lead the hearing. Thank you so much for being here.
Thank you, Governor. Thank you, Mayor Pugh. Thank you, Johns Hopkins, for pardoning the inconvenience of having a committee of Congress come and appreciating the seriousness of the issue that brings us here. The committee will come to order. Without objection, chair is authorized to declare recesses at any time. I'm going to break from protocol a little bit because we are in Mr. Cummings' hometown and because he cares so passionately about this issue, we are going to recognize you first for your opening statement.
Thank you very much, Mr. Chairman. And I want to, first of all, just mention one thing that's so important to me, Mr. Chairman, to the members of this panel. I cannot come into this hospital without saying thank you to Hopkins for saving my life. And spent 60 days here this summer, and a lot of it in this building. And so I want to thank, I see a lot of white coats out there and others, but pass the word. I thank you for what you have done for me and my family. I want to begin by thanking Chairman Gowdy for calling today's very important hearing and for bringing the Oversight Committee to Baltimore. I also thank my colleagues for coming to Baltimore, and certainly my colleagues who represent Baltimore along with me is Dutch Ruppersberger and John Sarbanes. I thank you for being here. I've been in the Congress now for 20 years, and I've been through and seen a lot of field hearings. I've never seen as many members attend any field hearing since I've been in Congress. I believe today's remarkable turnout reflects the fact that the opioid crisis is truly a national emergency that does not discriminate based on politics. It affects red states and blue states and every state in between. So I'm extremely grateful that the chairman agreed to my request to bring the committee on the road to investigate the devastating effects of this very difficult problem. I also want to thank Dr. Miller and Johns Hopkins for your warm welcome and your hospitality. The work that you do makes a huge difference in our community and around the globe. I also thank our esteemed guests, Governor Hogan and Mayor Pugh, for joining us. We are honored to have you in our presence. And of course, I thank our witnesses, Governor Chris Christie, Commissioner Wynn, Dr. Alexander, and Mr. Baum. Thank you for testifying and for all that you are doing to help us combat opioids and save lives. A year and a half ago, at our committee's first hearing on this issue, I warned that so many people were dying in communities across America and that we could no longer ignore this emergency. Today, the Centers for Disease Control and Prevention estimates that more than 64,000 Americans died from drug overdoses in 2016, an increase of more than 20% over the year before. To put this in perspective, the death toll from drug overdoses last year alone was higher than all U.S. military casualties in Vietnam and Iraq wars combined. Every 20 minutes, someone dies from an opioid overdose. If today's hearing lasts for 2 hours, half a dozen families will have lost a parent, a sibling, or a child to opioids. We have the reports. We've had years of talk. Now it's time for action. The American people are looking for us to take action. They're looking to the President and the Congress, and they're asking, what are you going to do? Governor Christie and the other members of the President's Commission on Drug Addiction have given us an excellent blueprint for action with dozens of recommendations. Now it's up to us, Republicans and Democrats, federal, state, and local officials, researchers, policymakers, doctors, drug companies, health providers on the ground, and families of the faith communities. We need to work together to end this epidemic. There's some things that we can do right now to help prevent addiction and save those who already have this disease. For example, we can ensure that every single person who needs naloxone has it. The Commission's report highlights the importance of equipping first responders with naloxone, including police officers, fire departments, and public health officials. But here's the challenge. Drug companies have continued to hike the price of this 45-year-old drug, and communities have been forced to ration it. In September, I led 50 members of the House of Representatives in sending a letter urging President Donald Trump to negotiate lower prices for naloxone, just as the Commission recommended. Unfortunately, we never received a response. The President should act now to ensure that naloxone is available at a reasonable price whenever it is needed. We also need to ensure that every affected person has access to effective treatment. According to the Commission, and I quote, today only 10.6% of youth and adults who need treatment for substance use disorder receive that treatment. Only 10%. There's simply no way we will end this crisis of 90% of those affected are not being treated if we do not act now. To do this, we need funding. Last month, President Trump declared this epidemic a public health emergency, but he did not propose any additional funding to combat it. We cannot fight this epidemic without funds equal to the challenge we face. This is a sad but stark truth. So finally, we must recognize and acknowledge the many factors that put people at risk. Woefully inadequate support for our children and our vulnerable residents, worsening economic inequality, lack of opportunity, and profound disparities in the criminal justice system. We cannot solve this crisis until these risk factors are addressed. With that, Mr. Chairman, again, I thank you for convening this critical hearing, and I look forward to the testimony and taking action on it. And I ask, Mr. Chairman, with unanimous consent, that Representative Ruppersberger from the state of Maryland and Representative Sarbanes from the state of Maryland be permitted to sit in with the committee and participate in this hearing today. And with that, I yield back.
Without objection, welcome to our colleagues. I also want to thank the Johns Hopkins community for taking such great care of our friend and colleague over the summer. You send him back stronger than ever. So thank you all for whoever had a role. You didn't have to send him back quite that strong, but you send him back stronger than ever. Governor Christie, Governor Hogan, recent, past, and present governors have witnessed the most devastating drug epidemic in our nation's history. Since 1999, more than 500,000 Americans have died from a drug overdose. And the epidemic is escalating. Over the span of nearly 20 years, the death toll has quadrupled with the emergence of even more potent drugs and an ever-expanding online market for illicit distribution. Today, drug overdoses kill more Americans than gun homicides and car crashes combined. That is a staggering reality. 2 out of every 3 daily deaths from drug overdoses in the United States involve an opioid, a class of drugs commonly prescribed to relieve and manage pain. Nationally, over 33,000 Americans died from an opioid-related overdose in 2015, which is an 11% increase from the year before. In South Carolina, where I come from, Greenville and Spartanburg counties in particular suffered more than 100 opioid-related overdoses in 2015, and while the numbers in the upstate of South Carolina are fewer when compared with cities like Baltimore, behind every number and every statistic is a life with loved ones and friends and potential and aspirations. We have a tendency to use numbers in government and in our line of work, but the victims aren't numbers. The victims are fellow human beings ravaged by the consequences of drug addiction, including the abuse of prescription painkillers. We are a remarkable country of progress and innovation, community, and charity. We can cure diseases that past generations lived in fear of. We can put people on the moon, and we can split atoms. Yet we're struggling with how to respond to this epidemic. I guess we need to start with how did we get here? There are more illicit uses for these drugs, and there are illicit uses for these drugs, and there are illicit uses for these drugs. One is unlawful, of course, the other is legal, but with the potential for abuse and misuse remaining. Physicians have a role to play for certain. These drugs are not available legally without a prescription. What are the pharmaceutical alternatives? Is there overprescribing? Is there sufficient information shared with patients to avoid misuse and abuse? Frequent exposure and easy access to painkillers has led to dependency intolerance, which drives those with a substance use disorder to intensify doses or methods with or without the help of a physician. Addiction to prescription painkillers is growing exponentially. On the illicit side of the equation, malevolent actors are diverting high-potent pills to the black market to be laced with heroin, resulting in drugs so lethal they have been called gray death, a term used to describe the high risk associated with every single injection. Opioid-related overdoses are now deadlier than the HIV/AIDS epidemic at its peak, more insidious than the cocaine-based cocaine powder epidemic that predated it. So there are a plethora of questions to be asked, such as whether we are being as effective as possible in the diversion of these highly toxic substances. I actually like doctors. I happen to be the son of one, but I also prosecuted doctors. And I want to make sure the DEA and DOJ are effectively going to the source of prescriptions issued outside the course of a professional medical practice. Is HHS monitoring insurers placing pricier but less addictive opioids out of reach for patients with acute pain? Are states regulating so-called sober homes, which can move vulnerable patients in and out of treatment, typically for profit? These are the questions our committee and the American people want answers to. The health and safety of our communities all across the nation are at risk. Although almost everything seems capable of being reduced to political exercise in our current environment, I genuinely hope that this epidemic is above that. I hope it's about protecting those susceptible to addiction and punishing those fueling the epidemic. Death, especially the premature death of a young life, has no political or ideological bent. Victims are victims, perpetrators are perpetrators, addiction is addiction, heartache is heartache. So the issue to me comes down to those of good conscience earnestly seeking a solution and those of a malevolent conscience bent to profit off of other people's addiction and pain. It's not just the deaths that devastate our families and communities across the healthcare system. It's also the disease of addiction that is permeating and threatening in some places within our country, the very fabric of those communities. At the same time, pain is real. It is real for a home builder in Mr. Cummings' district or mine with immense back pain. He can't otherwise get out of bed in the morning without his physician-prescribed pain medication. So how do we solve this epidemic? There's a prevention aspect, there's a treatment aspect, there's an education aspect, there's an enforcement aspect, there's a punishment aspect, and there's an oversight aspect. In March, the President signed an executive order creating a commission consisting of governors and attorney general, mental health advocates, and a professor of psychobiology to recommend policies for the federal response to this epidemic. And earlier this month, the commission finalized recommendations for how the federal government can help states and stakeholders tackle the evolving crisis, and stave off emerging threats. Today, we'll have an opportunity to highlight the report, and in Baltimore, and appropriately so. We will also examine Baltimore state and federal partners and how they can assist with and learn from the efforts that are occurring here. The devastating statistics may leave us feeling like we have just left the start line. But our country is resilient, and we have resources, we have compassion. I think we have the commitment to win this battle with opioid and opioid addiction. So I want to thank all of our witnesses. Governor Christie, you are the governor of the great state of New Jersey. As I mentioned to you in the ante room, you're also a former United States attorney, so you are uniquely well suited, and we cannot thank you enough, not just for your presence today, but for your willingness to undertake this vitally important responsibility and role, and with that, you are recognized.
Thank you, Mr. Chairman. Ranking Member Cummings, thank you for your work in this area, and thanks to all the members of the committee for inviting us today. As the chairman mentioned, in March, the president asked me to chair his commission on opioid and drug addiction in our country. We worked together to name a bipartisan group of people to join that commission. And I think that's an important place to start. I could tell you, as the chairman referenced in his remarks, and Mr. Cummings in his, I am acutely aware, as a Republican governor in the state of New Jersey, that there is much that divides political dialogue in our country right now that makes it very difficult for us to get things done. This cannot be one of them. I read the obituaries that are happening regularly in our state, and in none of the obituaries do they designate whether the person who died was a Republican or a Democrat. They're a son or a daughter, a husband or a wife, a mother or a father. And so I hope that what we tried to do in the commission and this committee is trying to do today will help to give this problem the ability to rise above the partisanship that we have in our country today. It is true this is the greatest and broadest public health epidemic of our lifetime. Everything else pales in comparison to the breadth of this problem. It is everywhere in America. 175 people are dying per day, which for someone who comes from where I come from, the most powerful analogy is that this means that we have a September 11th every 2.5 weeks. Every 2.5 weeks. Now I want to ask all of you and ask this committee, if we had a terrorist organization that is invading our country and killing 175 of our citizens every day, what would you be willing to pay to make it stop? We don't ask that question in this country. And the reason we don't ask this question, in my view, is because we still believe that this addiction is a moral failing. We are making moral judgments on the people who are suffering and dying, and we're making moral judgments on their families. Every time I go to a drug treatment center in my state, and I ask someone who's in the midst of treatment, tell me your story. Within the first 2 minutes, they say to me, but Governor, I'm from a good family. And my response always is, why would you think I would think otherwise? The reason why they believe that is because the stigma that is attached to this disease each and every day makes people believe that they have to defend their very upbringing, their performance as parents, their role as a child. That somehow we believe that this is a choice. I would love to see a show of hands in this audience that who has not made a bad decision in their life. Usually works. Fact is, we all have. Many of us in this room are fortunate that bad decision was not to abuse opioids or heroin, because if it had been, we might be in a very different judgment position than some people are today. Addiction is a disease. It is a chronic disease, and it needs to be treated as such and viewed as such. That's why I'm proud that the president declared this a national public health emergency. Now, as Mr. Cummings mentioned, we need to fund the Public Health Emergency Fund, which by my last check was at $66,000. I don't think that's going to make it, everybody, in combating this problem. We need to fund the Public Health Emergency Fund to make sure that the administration has at their disposal the resources that they need to implement the recommendations that the Commission has made. We had lots of discussion in the opening remarks about the role of physicians and healthcare providers in all of this. Let me be very clear. This is a drug epidemic that did not start on the corners of Baltimore or the corners of my hometown in Mendham. They started in doctors' offices and in hospitals across this nation. And while some of it, as Chairman Gowdy implied in his remarks, are done by folks who have bad intent, most of it is done by folks who have no intent. Why do physicians and healthcare providers have no intent on this issue? Because they're not educated on this issue. Broadly across our country, in medical schools, in every state in the union, we are not educating our future doctors and nurses, dentists, on the dangers of these drugs. We grant DEA licenses to write prescriptions for these drugs without requiring continuing medical education on opioid addiction and how it can lead to heroin addiction. I, as a lawyer, recovering lawyer, but a lawyer nonetheless, I have to, even as governor today, I have to take continuing legal education every year to maintain my license. And I'm not practicing. How is it that physicians can have a DEA license and not be required to have continuing medical education on this very problem when 64,000 people died last year? The Commission recommends that we do that. And if you don't believe that limits on opioid prescription length as an initial prescription work, with exceptions obviously for people who are terminal from cancer and in hospice, let me tell you what's happened in New Jersey just since we put a 5-day limit on opioid prescriptions beginning on March 1 of this year. Opioid prescriptions in New Jersey are down 15% from March to October, and the number of pills are down 20% that have been prescribed in just that 7-month period of time. Those restrictions work, and they should be instituted in every state across this nation, and that is also in the report. I want to commend the President for granting waivers to states now for the old-fashioned, antiquated, and ridiculous IMD restriction, Institutes of Mental Disease. It says that if there's any hospital healthcare provider that has more than 16 beds, 16, that those folks cannot be reimbursed for the federal share of Medicaid because they are a state psychiatric hospital. What that means is there are literally thousands of beds that could provide the treatment that Chairman or that Ranking Member Cummings recommended in his remarks, that could begin to take that 10.6% number up significantly, but are not opened because of this antiquated waiver. States have been asking for this ability to waive this for years. I commend the President for ordering that to be done. And tomorrow in New Jersey, the head of CMS will be coming to New Jersey with me to announce that New Jersey has received their waiver and that hundreds of beds will open within the next 6 months for people who need drug treatment. And these are folks who are the neediest in our society, those folks who qualify for Medicaid. We need to increase physician education across the nation, and we need to decrease the influence of the pharmaceutical industry on that education. See, right now, most doctors only get their education from the very companies that are producing the pills that they want them to prescribe. Now, as Chairman Gowdy said, I am a former prosecutor, and that makes me a little bit skeptical. And I'm from New Jersey, which makes me completely cynical. And so what that tells me is, if the only education physicians are getting are from those people who want them to prescribe these pills, and that in 2015, 259 million prescriptions for opioids were written in this country, enough to give every adult in this country their own bottle of 30 pills. 259 million. We are 4% of the world's population, and we consume 85% of the world's opioids. If you don't think that that's where this problem has started, listen to the CDC, who says that 4 out of every 5 new heroin addicts began with prescription opioids. We need to have alternatives to opioids because, as the chairman said, pain is real for many people in this country. But that's where the pharmaceutical companies should be spending their money, not on paying doctors to write more prescriptions for opioids. And so that's why we as a commission brought together Dr. Francis Collins, the head of NIH, and all of the executives of the major pharma companies in this country, in New Jersey, and got them to agree to a partnership where they will now work with NIH to come up with 2 different solutions to this problem. First, more non-opioid painkillers to be put on the market and be affordable. And second, more alternatives to medication-assisted treatment for those who are already addicted. Right now, we have 3 in this country. There should be more. Those pharma companies said they have 43 different compounds among them that could address either or both of these issues, yet they're not moving forward. We need NIH to be the accelerant for moving them forward, and I would urge this committee to look at additional funding for NIH specifically for that program to make sure that we work in partnership with the pharma companies to get these things to market along with the FDA as quickly as possible. If people have an alternative to opioids, both the physicians who prescribe these things for pain and the consumer who wants to avoid addiction, we have non-opioid alternatives, that will be enormously helpful in stemming the tide here. The insurance companies play a large role in this as well. Now, as a governor, I get folks all the time saying to me, well, why don't you change the regulation of insurance companies to make sure that they're covering drug treatment so that middle-class folks in our country who have employer-provided health insurance can get treatment, when right now, most of them do not. And I say, well, remember this. Only 30% in my state of the health insurance policies, employer-based health insurance policies, are regulated by the state of New Jersey. 70% are regulated by the federal government under ERISA. So we say, why doesn't the Department of Labor step in? Well, they don't have the authority to do it. Under the statute that Congress passed in the Mental Health Parity Act, they do not allow the Department of Labor to fine an insurance company or an employer who is not treating mental health and addiction with parity, and they do not allow the Department of Labor to investigate individual insurance companies. They must go employer by employer. How ridiculous is that? We urge the Congress and the Commission to give the Secretary of Labor both the authority and the responsibility to fine insurance companies that are not treating addiction with parity to all other diseases, and to give the Secretary of Labor the authority and the responsibility to be able to investigate insurance companies directly, not have to go employer by employer by employer, when we know that we have a number of very large insurance companies in this nation that cover thousands of employers. As a former prosecutor, I can tell you, one robust investigation is a lot easier to staff than 2,000 little ones, and much more effective. Lastly, and then I'll leave it for questions because I could go on for a long time, drug court is a very important part of this. We need alternatives to incarceration. We have put forward in New Jersey the largest criminal justice reform in the last 2 years of any state in America. And one of the things that we've done is institute drug court in every county in our state. What does it mean exactly? When you come in, not as a dealer, not as a violent actor, but as a nonviolent possessor, an addict, you are now in New Jersey required by law to go to drug court, and you are diverted to treatment, not to jail. Now, if you don't take your treatment seriously, and the judge decides that you are not utilizing the opportunity that's being given to you, they'll then send you to jail. But you're going to get a chance first to go to treatment. We should have drug court, and the commission recommends this as well, in every federal district in this nation. One judge in every federal district committed to dealing with the drug problem in this country, to diverting people into treatment, and to giving those families and those addicts who are suffering from this disease hope, an opportunity to get better. I'm a former prosecutor. I'm all for jailing people who profit from this poison. And I'm in favor of putting them in jail, whether they're standing on a street corner in any town or city in this country, or whether they're standing in a hospital or in a doctor's office. If you're running a pill mill and you have a physician, you should go to jail just as soon as this drug dealer on the corner should go to jail. But we will not solve this problem by incarcerating addicts. And we must get them the treatment that they need to be able to have the tools to recover. In New Jersey, we have now been the first state in the country to convert a state prison into a drug treatment facility. And so now, state prisoners who are in their final year of incarceration, who have a demonstrated drug problem, transfer from a standard state prison to the state prison treatment facility that we have on the property of Fort Dix in New Jersey, run by a certified addiction treatment company that works in conjunction with our Department of Corrections to give people the tools to deal with their addiction before they leave prison, so that when they get back on the street, we lower their chance for recidivism. All these things are in the report recommended for states and the rest of this country. We are proud of Governor Baker, Governor Cooper, Attorney General Bondi, Congressman Kennedy, and Professor Madras, who joined me on the commission and worked in a completely nonpartisan manner to make these recommendations to the president. And I hope that the members of Congress work with the president and hold the administration and each other responsible for getting something done on this issue. Thank you. I'm happy to take questions.
Thank you, Governor Christie. We'll now recognize the gentleman from Maryland for his questions.
Thank you very much, Mr. Chairman, and thank you, Governor Christie. I want to, and as I said to you before the hearing and now, an excellent report. I want to talk about naloxone a little bit. I had a situation, Governor, where not very long ago I was at an event for the Maryland Legislative Black Caucus, and I walked outside coming out of the event, and somebody just dropped a man right in front of the hotel. And I said, well, what's going on? They said, well, this happens all the time. We see people who may be at a party, and they don't know, the person has an overdose, and they don't know what to do. And I use that as an introduction with regard to naloxone because, of course, as you well know, it's a drug that has been used to save lives with regard to overdoses. And in your report, you all say, this is what you said, price increases of the various forms of naloxone continue to create affordability issues preventing state and local governments as well as community organizations from stocking naloxone at the levels necessary to rescue more people from the overdose. Is that correct, Governor?
That is true, sir. Yes, and what we recommend in the report is that governments, starting with the federal government, should band together to use their purchasing power to make bulk purchases of naloxone at lower prices. And there is no reason why we do this in many other areas of bulk purchasing, whether it's through the GSA, as you know, or through other entities to be able to do this. And there's no reason we shouldn't be able to do this with naloxone. And one of the things we're doing in New Jersey, which we also recommend in the report, is co-prescribing. When you are a physician, you prescribe an opioid, to prescribe at the same time naloxone to go to the home. Because some of these overdoses are not intentional, they're accidental. Someone who's in severe pain thinks, well, if 2 pills every 4 hours is good, 4 pills might be better. So it's not just for the person who's suffering from addiction, it's also from the person who unintentionally misuses this, to have naloxone available in the home so that, in an easy form, so that the folks who live with them, if they have an overdose like the one you mentioned outside the hotel, it's in its nasal form now, it's very easy. It's 2 pushes of a button, one in one nostril, push the button, one in the other nostril, push the button, and you save a life.
You know, our health commissioner who will be testifying in a few minutes is one who has been very strong on, is Dr. Nguyen here in Baltimore. You know, but the thing that I think bothers me so much about naloxone is that the price was jacked up, I mean, big time, when at the very time when first responders and others were trying to get it because they saw the effectiveness of it. Did you have discussions with any of the manufacturer or drug companies with regard to naloxone?
We did not in terms of the pricing issues,
okay.
Congressman. What we did, though, talk about was the concept of bulk purchasing and their willingness to consider the idea of bulk purchasing lowering prices. And so we did talk about that with the manufacturer, with a few of the manufacturers, and that's why we urged it in the report. We believe it's something that can be done, and that these manufacturers recognize, and the Commission emphasized to them, their social responsibility.
And that negotiation recommendation that you just talked about was in, I noticed it was in the interim report, but I didn't see it in the final report.
This is some confusion. The way the executive order was written, Mr. Chairman, was that the President wanted first an interim report and then a final report. They should not be read as mutually exclusive. They should be read together. And so if there's, I think, 56 recommendations in the final report, there's 9 in the interim report, we've made 65 recommendations. So the 9 interim recommendations remain fully in force and effect and should be added to the final report.
Good. Well, I'm glad you clarified that. I thought you just kind of changed your mind.
No, sir. I think you know me well enough to know that changing my mind would be a difficult thing. Listen, I reminded the White House on a regular basis, and you need to know this.
My last question is...
This was our report.
My last question is this. Have you discussed this report at length with the President? In particular, have you discussed this naloxone recommendation?
Yes, I have discussed.
And what response did you get?
I did not. Let me fully answer this, sir. We have discussed the report at length. I have not discussed the specific pricing issue on naloxone. My conversation with the President was more on how important it was for all law enforcement officers and first responders to have it. But we did not get into the pricing part of it in my conversation directly with the President, but I have had that conversation with other members of the administration.
Thank you very much, Mr. Chairman.
Thank you, sir.